hi everybody, welcome. I am Claudia Taylor with the UNT Alumni Association, and welcome to this week's episode of UNT Alumni Live. Thanks so much for joining us today as we kick off our new season in 2021. I hope you've got your precious pets with you like my little Raleigh here, because today we're chatting with veterinarian and UNT alumna, Dr. Erin Tate, live from her clinic in Frisco. We'll hear about Erin's time at UNT, including a childhood spent on campus as the daughter of a North Texas faculty member, and get an exclusive look at one of the 3 clinics she's built up in her successful career. We'll even get to meet some cute animals, so make sure you have your pet health questions ready for Dr. Tate. Before we get started, a few reminders. If you're joining us on Zoom, please keep an eye on the chat section at the bottom of your screen. I'll be posting some useful links there, and you can also use that to send me your questions for Erin. I'll also post a survey there. As always, fill that out and you'll be entered to win a UNT prize pack. If you're watching on Facebook Live, welcome. You can leave us your questions in the comments there, and we'll get to as many as we can. Now, before I hand the program over to my colleague, Casey Komodinsky, hey Raleigh, let me tell you a little bit about our guest today, Dr. Erin Tate. Born and raised in Denton, Erin grew up on the UNT campus, the daughter of a Regents professor in political science and former dean of the Toulouse Graduate School. After earning a bachelor's degree in biology at UNT in 1994, she went on to earn a doctorate in veterinary medicine at Texas A&M. She opened her first veterinary practice in 2004 and has since opened 2 more, specializing in small animals and exotics. Erin is also chair-elect of the UNT College of Science Advancement Board, helping fundraise for the college and increasing research and education opportunities for current students. In addition to helping animal lovers across North Texas take care of their furry friends, Erin and her family also care for their own menagerie of 5 cats, 2 dogs, and 2 giant tortoises. Erin, thank you so much for being here, and Casey, take it away.
Thank you so much, Claudia, and thank you, Dr. Tate, so much for joining us. This is so exciting because who doesn't love to spend time with their beloved pet? And today is a great excuse for us to have our pets in the office, in our laps at home, and hear a little bit about you and your story. So you've got a remarkable raising and upbringing, growing up in Denton and even on the campus. So why don't you start there and tell us a little bit about what that was like?
Sure. Yes, I was born and raised in Denton. My father was a political science professor at the University of North Texas. And so I grew up in the university, going to work with my dad in summers, spending time in his office. He even let me work for him a little bit in the summertime, answering phones and doing paperwork. And I was cleaning out a box the other day, and I even found my old punch card from the early 1980s working at my dad's office. So I grew up on North Texas's campus and spent lots of time there. When it came time to go to college, it was a natural choice for me to go to North Texas. My dad was still a professor there at the time. It was lots of fun when my classmates and friends would say they had my dad for a teacher and he was really tough and I should ask them to go easy on them. So it was a great place to be after being there as a kid. And then after my 4 years at North Texas, I was fortunate enough to get accepted at Texas A&M and go to vet school at Texas A&M and become a veterinarian and moved back to Dallas. And my parents were still in Denton when I graduated from vet school. My dad retired in the early 2000s from the University of North Texas after being there for 30 years. So it's been a lifetime for sure for our family with UNT.
That is so exciting and so cool. And I think it's also really fun because you're not only here as an alumna for UNT, but we also have a cameraman holding the camera for you right now who is an Aggie, and I'm surprised we didn't hear a whoop. Right, Daniel, you were holding it back. I'm proud of you.
I know where I work. I know who pays me, so I'm mean green for life.
And he's dressed all in green today too. So.
And he's also working on his doctorate, so good on him at UNT.
Fantastic. They're both wonderful schools.
Yes.
That's right. Well, Erin, I think that it's funny that you grew up in Denton and everything, but tell me a little bit about the affinity that, sorry, I can't talk today. Words are really hard. The affinity that you have for UNT and what were some of the most memorable moments you had on campus?
So, interestingly enough, being from Denton, I was an only child. My parents said if I was going to go to North Texas, that I couldn't live at home and that I had to make friends other than my high school friends, meet new people, branch out. So the best way to do that in my eyes was to join a sorority. So I was a member of Zeta Tau Alpha sorority in my years at North Texas, which was probably the best decision I ever made. I made some amazing friends that I'm still friends with, 25 years later. And I learned a lot of leadership skills. I was vice president and second vice president. I was the pledge mom in my sorority. So I learned a lot about managing people and leading people, and trying to make good decisions for groups, and just really kind of gave me my foundation in leadership. Oddly enough, becoming a veterinarian, most of veterinary school is truly just learning veterinary medicine, the science, the animals. It's not a lot about leadership or business skills. So I'm very fortunate that I had my time at North Texas in my sorority to kind of give me that background. I will admit my dad being a teacher probably helped a little bit too, to ingrain that in me. But that was really just, the most important part of my time at North Texas was being in my sorority. Really gave me an outlet to grow and learn new things and become a different person still living in my hometown. So it was great. I really enjoyed it. I still love North Texas and get back to Denton when I can, which looks different every time I come back, which is amazing from where I started, because I grew up in the 70s and 80s in Denton. It was a totally different place back then.
It has completely transformed. It is remarkable. I'm glad you brought that up, because I want to encourage everyone that's watching today. If you have not been back to campus in the last 5 years, you're due for a visit, guys. It is remarkable what is happening here in Denton. And
beautiful. It's beautiful.
It's so beautiful. And you get to come back and visit hopefully very soon, and for in-person board meetings. Fingers crossed we can get back to that real soon.
Fingers crossed.
Yes. So, speaking of in-person and the current world situation that we're in, how has COVID affected business for you guys?
In the beginning, when COVID first came down last spring, it was pretty scary. I think nobody in the society knew what to do or how to respond. So we lost a lot of business initially the first couple of weeks. It was very scary, thinking that everything I've worked so hard for may disappear. But quickly, when people were sheltering in place and staying at home, they started spending more time with their animals and realizing little things that maybe they should get checked out that they've been ignoring for a while because they were busy and just didn't have time. And, maybe it's time to get a new puppy or a new kitten. That's probably been the most fun of the COVID, is all the new puppies and new kittens have been fantastic. So many people have new puppies and new kittens. And that's my favorite thing to do, is a new puppy or a new kitten. It's like a blank slate. Again, that's the educator that comes out of me. I love nothing more than to teach someone how to potty train their dog and talk about nutrition and talk about animal care and all of those things. Is probably that's the best part about being a vet. So we're very fortunate that despite COVID hitting so many people hard, economically speaking, and so many people losing jobs, that we have continued to grow our business and keep our employees and keep our clients and stay busy, which is good, because I'm not a stay-at-home kind of person. I like coming to work. So glad I don't have to work from home.
I can definitely relate to that. It sounds like you've got a little bit of that educator in you and passed down in your genes there, because of the way you do like to teach people and train them the right way to do that. And that is very rewarding and fulfilling to see these animals come back and time after time and know that they're well taken care of and well loved because of the direct impact of your guidance. So that's wonderful, Erin. I tell you what, we do have a couple of questions rolling in, and I see Cami is asking some questions about teeth cleaning. And Cami, we're going to address that as soon as we get into the exam room, and that way Dr. Tate can actually demonstrate for us some things to look for and talk about. So stick with us, Cami, don't go anywhere. All right. So Dr. Tate, I know that, man, there's so much to talk about here. You mentioned your affinity for your Greek organization and the getting involved, and the leadership role there that came out of that. And you talked about how that helped you in starting this business and getting things going. But have you faced any kind of adversity as a female starting a clinic in what is predominantly a man's world?
Sure, absolutely. I think the female veterinarian is taking over as the veterinarian. The females are actually more predominant in this field than males are now. But when it comes to the business ownership and running a business, that part maybe isn't quite as female yet. Hopefully that will change. So, you know, a lot of it is and I love all my colleagues and everyone I work with, but I do work with a lot of men who, you know, are in business and teach business and know a lot more about business that I've kind of been lucky to learn from, but also been able to show that I've got just as good a business head and a nice sense of ethics as any other person in this business, male or female. It's, you know, it's sometimes tough to prove that you can do every bit as much as some of your male counterparts. But, you know, I think if you really love what you do and you have a good foundation in leadership, like I did coming from North Texas. I failed to mention earlier, also, I met my husband at North Texas. He was a Sigma Chi at North Texas. So we both came from North Texas and have grown through this experience of starting vet clinics together. He's been with me quite a long time through this process as well. So it's, you know, it's still tough to be a mom and to balance that when you're running a business and being a veterinarian, because being the kind of person I am, I want to be successful at all of these things: family, kids, veterinarian, the business. And it's really important to me to teach other veterinarians how wonderful our profession is and how great any woman can jump in this profession and become a business owner if she wants. One of the things we do at City Vet is we actually train and mentor younger veterinarians so that they too can have their own practices in City Vet one day. And that's something I've also been involved with in recent years is trying to guide and mentor new vets. And I've been able to help a few of them open their own new clinics. One of them actually just opened a clinic a couple of weeks ago in Fort Worth. So that's another great experience that I've had as a business owner and a female leader in City Vet, is to be able to help us grow and expand and show other veterinarians how they can do the same thing.
Oh my gosh, that is so remarkable and so inspiring. And so thank you for sharing a little bit about that.
Absolutely.
I got a little sneak peek before we went live and got a little tour of the space. And Daniel, I think it's time that we show off this beautiful space that Dr. Tate has built and has even expanded upon over the years, and to show off how remarkable this is, guys. This is beautiful. So Dr. Tate, I will let you take the lead here.
All right. Well, this is a little bit different than most veterinary practices. I'm a believer in complete pet care and offering my clients not just veterinary care that is medicine and surgery, but also that whole experience, from what kind of collar should they wear, what bed should they sleep in, ear cleaning, food, nutrition, all of those things. So it's really important to us at City Vet to be able to offer that to our clients as part of the education for their pet. So you'll see we have actually a full retail store, from collars and leashes, dental care, lots of different foods, even some frozen foods for the people who really want to take the extra time to prepare food for their animals.
I can barely get food on the table for my family. I can't imagine.
Right? Varieties of canned foods, dry foods, supplements, ear cleaners, toys, lots of toys as well over here too. Tons of food, not just over-the-counter diets, but of course we have to do the medicine as well with the diets, and a lot of our prescription diets we use to treat disease in dogs. So a variety of different prescription diets for treating pets as well. But so this is my retail area, which is, again, pretty large for a veterinary clinic. Most vets may have a small area, but this is something we really embrace and love. So now we'll go to the nitty gritty where the medicine happens. So right this way, Daniel.
That is wonderful. You mentioned pet beds as you're walking back there. That's fascinating. I never would have thought that animals need a special type of bed. Can you elaborate?
Yeah, sometimes I might need like an orthopedic bed if they have arthritis, a cooling bed. It really just depends on the pet. Some animals prefer to have beds where they can kind of burrow in them and feel like they're safe. So yeah, you'd be surprised all of the little things that you don't think about that can affect your pet's mental health. So, all right, come on back.
Fascinating. Oh, wow. Look at this. This is lovely. So beautiful. And
This is my treatment area where the magic happens, so to speak. Some of my lovely veterinary nurses here, hard at work, and we do most of our procedures back here. Take care of, as we see, we've got some patients here, some cats, some dogs, some well ones, some sick ones, some baby ones down there too.
Oh,
You want to see the baby one.
Little bit of everything. And then back this way, more space, we have wet tables where we do teeth cleanings for dogs. Since they get quite messy, we have to be able to drain through there. We can do things like take x-ray, do ultrasound as well, lots of diagnostic tests that are very helpful in treating and diagnosing animals. Surgery, we always have to do surgery. That's just, part of what we do. All the fun stuff we do, from spays and neuters to cancer surgeries and orthopedic surgeries, happen in here. That part's not bad. You really want to see the laundry room. So after we have, I think one of the things that is nice about our clinic, we also have what we call a quiet room, which is a nice space if you have to come and have end-of-life talks about your pet. It's a little more homey than your typical exam room.
Oh, I love that.
And then lots of different exam rooms. Try to make them fun and pretty. We've got a little art in each exam room just to make it fun when you're here.
That's
I like
beautiful.
to vary my cats, my dogs, different animals.
So are these actually photos of your cats and dogs?
They're not my personal ones, no.
Okay.
They are ones that we devised with our marketing gal to kind of fit the mood, and we wanted the mood to be lively and fun and light and not feel like a dark, scary hospital. A place that's fun to come with bright colors that you feel good coming in, modern. We try to be a little bit different from your average vet clinic.
It's beautiful. Well done.
Little work at bay here. Let us let a dog through.
Is someone talking?
Okay. We had an unhappy dog, but he went the other way, so we're okay.
Oh.
Okay. Lobby area. I think Daniel may have already showed you kind of the lobby area here, and more exam rooms. And if you want, we can grab Zen and do some work.
Perfect.
Yeah. Let me grab Jackie.
All right. So people want to know the name of the dog that has been following you around. Uh-oh, we lost her.
Want to say hi?
Say hi. Sandy, you gonna come meet the demo dog? Let's go, bud. Come on. Come on, Zen. Let's go. Come on, Zen. Good boy.
Let's go. Oh, no,
see
you kind of scared.
Oh, it's okay. Sorry. He knows he's gonna get his ears cleaned and he hates it.
Oh, I'm sorry.
It's okay. We'll start with this Caspian first.
It's okay.
So I actually have a snake patient here today. This is Caspian. Caspian is being treated for a bacterial infection. So he's been coming in every other day to get an antibiotic injection. He's actually quite a friendly snake. Come here, Caspian. This is Jackie, my veterinary technician, that's going to help me.
Hi, Jackie.
So snakes are, like I said, this guy's a pretty friendly snake. Usually for snakes, they oftentimes will get pneumonia. They may get skin infections. This little guy has been dealing with kind of a systemic infection that causes him to be lethargic and not eat very well. So he's getting some antibiotics. So we're gonna give him his injection. You guys can watch really quick. I will let Jackie hold him.
So what kind of snake is he?
This is a king snake.
King snake. And how is he fully grown, or will he continue to get?
He is fully grown. I believe he's about 8 years old. Pretty sure.
And what's the average lifespan of a king snake?
These guys can live pretty sure into their early teens. So snakes can kind of, they'll be usually the bigger the snake, the longer they live.
Oh, okay.
So we're going to give him his little antibiotics. So when we give these guys injections, we give an injection in their muscle, and we give it in the top third of their body.
And why is that the top third as opposed to anywhere else in the body?
If you give it, the way that they metabolize, if you give the injection in the bottom third of their body, their kidneys will take it out before it goes throughout the whole system. So we do it in the upper third of the body so that it can go through the whole body before the kidneys do their work that they do for all animals by excreting things that come into the body. Okay. All right, little friend.
Rabbit guy.
So we're just gonna go rub a little spot right here. And he's a really good snake. He doesn't mind this. We'll go directly in. I'm hitting some bone there. If you hit bone, you come out and you try again. Between your ribs, there we go.
Sorry, I'm holding my breath. I don't want.
All done. Caspian does get a little feisty after that. All right, you can go back in your seat. Here you go.
Great job, Caspian. We're proud of you.
Yeah.
And to the owners, thank you for letting him demonstrate for us today.
Yes, thank you. They're wonderful snake owners, I have to say. They take great care of their snakes.
I love it.
Okay, want to do some dog stuff now?
Yeah, well, I would also like to point out that we have a dog in the same room as a snake, and they're not trying to kill each other. That's remarkable. I don't
He
know.
was just sniffing the snake a minute ago, weren't you? Do you want to say hi to Caspian too? You can see that they can be friends. Do you want to show off a little bit that you're nice to all animals and that Caspian's nice too? Come here, Caspian. Say hi. Ooh! Did you get a tongue up the nose?
Oh, Caspian likes you a lot.
There you go, your dog snake entertainment for the day. All right, Miss Roseanne, you ready? Let's just show them how to clean ears. So, depending on what kind of dog you have, dogs that have ears that hang down, so Labradors, Golden Retrievers, Cocker Spaniels, there's so many dogs that have Labradoodle, Golden Doodle, you name it. The dogs that have the ears that hang down, they're more prone to having ear infections from heat and humidity that build up in their ears. So for these guys to try and prevent ear infections, we do routine ear cleanings. And this is something that most people can do at home to help keep their dog's ears clean and prevent ear infections. This guy just so happens to have gross ears all the time because he has bad allergies, so he gets ear infections. So I'm sure his ears will be nice and gross for us to clean. So when we clean ears, we're gonna get a good ear cleaning solution, which most ear cleaning solutions you can buy at pet stores, your veterinarian, online, just formulated for dog ears, not human ears.
Okay.
So let's see. Let's grab a couple of
And is that sort of a saline solution with?
It is a drying solution. So essentially, it is made to be, got a client waving at me through the window. It is made to be antiseptic. So it's antibacterial, antifungal, drying. You know, if you were to make a solution yourself at home, you could take 4 parts water, 1 part vinegar, 1 part alcohol, and make your own solution as well. Again, the idea is to keep the ears dry and to kill organisms. So when you clean ears, you're gonna, make sure this is open. Yeah, that's good. You're gonna fill the ear. Probably the biggest mistake that people make when they're cleaning dog ears is they don't use enough of this. They're afraid to put it in the ear, but you really wanna use a lot. So we're gonna turn this ear up and put the solution in here, and I'm really gonna just fill this ear all the way to the top till it's literally pouring out of his ear. And then I just massage it like this to break up all the wax. And he makes that great little dog face. Silly boy. And then I'm gonna take my finger with my cotton and just swab out the ear. I know, see, I told you he'd have good gross ears. And I'm just gonna wipe all this nasty stuff out like that. And then, just like our doctors tell us, you don't want to put these Q-tips down in the ears, but you can go around the cartilage areas of the ears to clean and get all the dirty stuff out. I know you hate this, I know. Okay, let me see your other ear, friend. Let's turn around.
He's doing so good.
He's a good boy. He doesn't care for it, but he does let me do it. Okay, let's clean this one too.
So is there a general rule of thumb as far as ear cleaning? Should, you know, the owners plan to do this monthly or quarterly, or just keep an eye on it, and when it gets funky, clean it out?
So it really depends on the dog. Dogs that have allergies have to have this done much more frequently. So like you can see, dogs with allergies should have their ears cleaned at least once to twice a week. But if you have a dog that has just normal ears, then I usually say clean them anytime you bathe your dog. Or if your dog is a swimmer, you want to clean them after you go swimming, because the water from the swimming pool can cause ear infections as well. But generally speaking, if you just want to do it for maintenance, about once a week is pretty good.
Wow, that's fascinating. I had no idea. Now I feel like I've been a negligent dog parent.
No, not negligent. We're here to learn, right? That's what we're here for. So,
Change now.
there
Yeah.
you go, bud.
We're
Okay. You want to see some teeth stuff now?
Yeah, in fact, we've got a really great question about teeth that I wanted to ask you. And, one of our viewers has a 13-year-old foster dog who needs her teeth cleaned. He's asking, is it safe or not? Should she do it because of her age?
So the majority of dogs' teeth that we clean are senior dogs and older dogs, because they just tend to have more tartar, and a lot of dogs haven't had their teeth cleaned routinely in life. So being a senior dog is not a disease in itself that would prohibit anesthesia, as long as the dog is otherwise healthy. Now, any dog that undergoes anesthesia should have pre-anesthetic blood work done either a few days ahead of time or on the day of the procedure, to make sure that there aren't any complications that could occur, if there's any special precautions we need to take. So you want to do that before you put them under anesthesia. But if they're otherwise healthy and have no conditions that are of concern, the anesthesia is very, very safe. The anesthetics we use in dogs these days are the exact same ones that they use on people. So if you were to go have an outpatient procedure, you and your dog literally would have the same anesthesia. So they're extremely safe and short acting. Now, if you have an older dog and it has a heart murmur, let's say, that dog should have some chest x-rays done prior to undergoing anesthesia. Again, just as a precaution to make sure that we minimize any complications. Fortunately, these days, anesthesia is very, very safe. The risk of anesthesia is far less than the risk of disease that dogs develop by walking around with dental tartar and bacteria in their mouths. Because dogs that have dental tartar, not only are they at risk of losing teeth, but they are at risk of developing disease in their body. We do know in dogs that the bacteria in their mouths can set up infection in their hearts, in their kidneys, lots of places. Bladder infections are common because of teeth. So it's really important to have your dog's teeth cleaned. And quite honestly, the best thing to do is to clean the teeth before the tartar gets really bad, is more of a preventative versus waiting. I do probably 7 to 10 dentals a week, and I would venture to guess 75% of those dogs have teeth extracted because the owners have waited too long to have the teeth cleaned. Periodontal disease is really common in dogs, especially small breeds of dogs, where they don't just get tartar on their teeth. The tartar gets up under the gum line, it eats at the bone and eats at the root of the tooth and causes the teeth to fall out and get infected. So we spend the majority of our time doing dentals, doing a lot of extractions and dental work for teeth that could have been saved had routine cleanings been done earlier. So it's important to do. And a note on dental cleanings, you can find non-anesthetic dental cleanings. Most veterinarians will not recommend that, because for dogs, their problem areas are under their gum line. And so if you don't clean under their gum line, you're basically just doing a cosmetic dental. And any dog, no matter how good a dog they are, even this guy, will not let you clean under the gum line when they're awake. So that's why an anesthetic dental is truly the way to go. Versus the non-anesthetic dental, which is truly just cosmetic and not really going to benefit your pet very much. But I'm a big proponent of the preventative dental and doing it before the tartar builds up and becomes more of a problem. Probably more than you wanted to hear.
No, that is fascinating. And I'm in awe, because there's so much I had never thought about or considered. And it's just like with humans, having that preventative care is so important. So thank you for sharing all of that. And you were saying earlier, whenever you said you like to educate people, this is wonderful stuff. So thank you. You're a wealth of knowledge. We have
I'm going to pick on everything, whether you like it or not.
I love it. Keep it up. I tell you what were we about to do? I just got distracted. The dental clean.
You want me to show how to brush teeth?
Yeah. And exactly. And how often should owners be doing this for their pets?
So you won't like this answer. In an ideal world, people should brush their dog's teeth every day, just like they brush their own teeth every day. But these days, there are a lot of ways to keep your dog's teeth clean besides brushing. Brushing is still the gold standard. Brushing is still better than anything else. But there are a lot of great dental chews these days that are designed to remove tartar and kill bacteria in the mouth that work really well too. So I usually tell people when it comes to dental care, it's kind of the multimodal approach, using chews, brushing the teeth, doing water supplements, things like that are really helpful to keep the teeth clean. But brushing is not as hard as it sounds. You just have to get used to it, and your dog has to get used to it. The toothpaste we use in dogs has to be a dog toothpaste, not a human toothpaste, because they can't swallow fluoride. It's toxic to them. We're not supposed to swallow fluoride either. Clearly, we know how to spit our toothpaste out. Dogs do not. So we have to use a toothpaste that's made for dogs. And the nice thing is they make toothpaste that are chicken flavored, beef flavored. They do make some vanilla mint that dogs like too, but you know, if the toothpaste tastes good, they're more likely to let you do it. And when you brush the teeth, once you get the hang of it, it's really a quick process. So let me grab my tools here.
Oh,
Let's see, where are my tools?
which flavor toothpaste do we get to experience today?
So we are going to actually use, this is all I had open. We're going to use the vanilla mint CET toothpaste. But CET makes the beef and the chicken and all the good seafood. They make seafood for cats too, because cats should have their teeth brushed, not just dogs. So, and then you can buy disposable toothbrushes. They're actually dog toothbrushes that come in little kits that have angled heads, and the angled heads sometimes are a little easier to get back into the back of the mouth. What I usually start with before I actually brush, when you're learning how to brush your dog's teeth and getting used to it, is to just use the toothpaste in your finger. So I literally just put a little bit on my finger, and you may let them kind of sniff and see what they think. You don't like vanilla mint, do you, Betty? And then he's not demonstrating very well that he likes it. But I take my finger and I just rub it on the teeth, just like this. What he's doing with his tongue is actually a good thing, because this toothpaste is enzymatic. So as he spreads his tongue around, he's spreading the toothpaste around, and it's working on the teeth. So that's how, bless you, buddy. So that's how you start. Then once you get used to kind of handling your dog's mouth, see if I can open this with my slimy hands. Okay, Jackie, I need your help. My hands are all slimy. Good boy. I know. Hold on. We're not done. Oh, I know. I know. Thank you, ma'am. Okay. So we're going to get a little bit. No, don't eat that. We're going to get a little bit of toothpaste here on our toothbrush. Come here, friend. And you're just going to lift the lip. And again, you're not really trying to go inside the mouth like we do on our teeth. It's really the outside surfaces we worry about. And I just put this toothbrush in here, and you just do this. Top and bottom, a little bit on the canine, a little bit on the front, flip it on the canine, back, top, bottom, getting towards the back of that mouth. And you're done. Just like that. So it doesn't take a lot of time, and it's not that difficult. Now, it's not for every dog. Clearly, some dogs will try to eat your face if you do that. But most dogs, especially if you start it when they're young as puppies, they'll be used to it, and it will be an easy process. So, and that is one of the best ways to keep your dog's teeth healthy, so you can actually prolong the time in between professional dental cleanings, so they don't get disease in those teeth. And then their breath smells so much better, because I think, Casey, it might have been you that one of you were mentioning earlier your dog's nasty breath, and nobody likes to have bad dog breath when they're sleeping, breathing in your face. So brushing the teeth helps with that too.
I'm picking up on what you're laying down there. I will see you soon. Okay, I'll make an appointment accordingly. That was really good. I'm sorry. I am still hung up on this. I have it in my head what it must look like to brush a cat's teeth. How do they tolerate that? What is that? What advice do you have for cat owners?
You know, I mean, it's not any different than the dog. It's the same thing. You start with the toothpaste. You start with your finger. And you got to be quick about it. You can't stand there for 20 minutes brushing the teeth. And as long as your cat is easygoing and friendly, it shouldn't be a big deal. A lot of people are afraid to touch their cat's mouths, like afraid to try and give them pills, afraid to brush their teeth. But really, if you, especially again, anything you start at an earlier age is always easier. But as long as your cat is friendly, and you know, if you can walk up to your cat and do this and rub its face and touch its nose and it doesn't get mad, you can brush its teeth. And it's the same thing. Cat teeth are just as important as dog teeth.
Absolutely. Makes perfect sense. All right. So we've got some other questions coming in about food and the difference between, I think, grain-free dog food. What is your take on that and versus the grain dog food?
So I could talk to you forever about my opinions on nutrition, and not all vets will maybe agree with me on this, but I feel like I do a lot of research on nutrition, so it's an important part of how you keep a dog or a cat healthy. So grain-free diets were really originally started as a marketing plan. It wasn't started because suddenly someone sat down and did research and said, oh, grain-free diets are better for a dog. It really started as marketing for the human nutrition wave when people were going through, eating carbohydrate free or, avoiding fats and avoiding glutens and all of those type things is kind of when it all started. But then as some of these companies started developing these foods and doing the research on them, we really did learn that grain-free diets were a little bit healthier for dogs, mostly in the ways that, dogs are more carnivorous. They're technically omnivores, but they are technically more of a meat-eating breed than they are, a vegetable, carbohydrate, grain-eating breed. So we did learn that there was a lot of benefits for dogs to feeding some grain-free diets. And I actually was one of the vets that liked grain-free and recommended grain-free for a lot of my clients. Now, a little over a year ago, there were some studies that came out reporting that grain-free diets were associated with certain types of cardiomyopathy, specifically dilative cardiomyopathy, heart disease in dogs that were on grain-free diets. And these reports didn't really necessarily say it was one breed of dog versus another, but it was primarily large breed dogs that were involved in this. And then, of course, the FDA does what the FDA does, and they do studies and try and prove or disprove whether this is true or not. And the FDA actually just came out, it's been about 3 weeks now, a month now. They literally just came out with a study that said that there was no correlation between feeding a grain-free diet and heart disease in dogs, which is good news for dogs because we had a lot of dogs that ended up transitioning back to diets with grain in them. Now, that is not to say that a diet with grain in it is a bad diet. It's just that there's different types of grain. It's literally the same thing as what we put in our mouth. A dog that's on a a diet with grain in it that has, oatmeal, barley is a lot healthier than wheat and corn. It's just like us eating, quinoa is better than white rice. It's the same principle. A grain is not bad. It's just the quality of the grain and the type of the grain that you put into your mouth or your dog's mouth matters. So, you're not going to go wrong with grain versus grain-free. You just want to make sure that you choose the right diet that is appropriate for your dog. And there are a lot of diets that have nutritional additives in them to help with digestion, like prebiotics and probiotics, or things for joint protection, glucosamine, chondroitin sulfate. Omega fatty acids are very healthy for dogs just for general body health. Many diets will put omega fatty acids in. A lot of diets will put turmeric in their diets now. Turmeric's a natural anti-inflammatory. So, it's really important to figure out what your dog needs as far as diet, because there are a lot of different diets, a lot of different varieties, a lot of different food brands. And these days there are so many food companies that are out there. It's really hard to kind of decide which is the right diet for your pet. And that's why I think your veterinarian is a really good resource. No offense to any of the people who may work in pet stores and sell pet food, but they don't have the same training as a veterinarian does or a veterinary nutritionist does. So that's really a good resource for people, is to talk to their veterinarian about what's best for their pet.
Absolutely. And that makes perfect sense. You touched on it just a little bit as far as the anti-inflammatories and the glucosamine and chondroitin, especially for the larger animals. Is there anything besides diet that owners with large breed animals can do to help prevent any joint disease or anything like that comes about later on in life?
Yeah. There's a lot of great joint supplements exist that come in many forms, from little soft chews to biscuits to sprinkle powders. But yes, their joint supplements are generally really good for dogs. The ones that typically have things like glucosamine and chondroitin sulfate, green lip mussel, omega fatty acids, essential avocado oils, things like that, that really help to protect the cartilage in the joints. And what I tell people is it's not the magic bullet that's going to fix your dog's arthritis or keep your dog from having pain. What those joint supplements do is they help to protect degradation of cartilage in the joints. So for instance, you have a dog that has hip arthritis, and every time his hip is rubbing back and forth like this, it's degrading that cartilage. And so these joint supplements are designed to slow that degradation so that there's less pain, because the more cartilage you have, the more padding there is in the joint, the less pain there is. And there's even some joint supplements that are actually designed to help rebuild cartilage as well. Not all of them will do that. There are some that will. So they're great supplements. They're very safe. And again, because they also have, a lot of them have essential omega fatty acids in it, that are also helpful for just general body health. It's a good supplement to do. So absolutely, I have my golden retriever on a joint supplement. I even have my little French bulldog on a joint supplement, because it's good for all dogs, definitely for large breed dogs for sure.
Sure. No, thank you. That's fantastic to know. Speaking of our older dogs, we've got a dog, specifically a 16-year-old that's still kicking, the owner says.
Yay!
Even after the bath, just smells old. What can she do? Is there any special care for older dogs to, make them a little more fresh?
Well, I will tell people, if your dog has a smell and it smells old, there's probably a reason. It's probably coming from somewhere. It is either an internal smell that's coming out through the breath. So if there's kidney problems, liver problems, infections, it can sometimes manifest through the breath. And it isn't necessarily a bad breath smell. It can just be an odd smell or a sweet smell or even a chemical type smell. So that's one thing that we look out for. Obviously, as we talked about before, teeth are always a big issue. And sometimes they can even have just like little infected masses, nodules on their body, toenail that's infected. So an odd smell on an old dog is not a normal thing. Even old dogs, although they may be, not as clean as they used to be when they were younger, they shouldn't have any weird smells. So if they do, then I usually say probably need to try to get to the source of that. If you can't find it yourself, again, checking with your veterinarian is always a good thing to do.
Absolutely. That, again, thank you. This is
Living to 16. Kudos. That's awesome.
That is very awesome for sure. Personally, I used to have 2 Huskies. In fact, one of them I got when I was in college here at UNT, and from the owner of Dusty's, actually. But anyway, I digress. I love that dog, and he's since long gone. But as he grew older, he developed these nodules and bumps underneath his skin, but they were benign. Is there anything that an owner can do to help prevent that? I mean, it almost overwhelmed him sometimes.
No, unfortunately, we can't prevent skin lumps and bumps from happening in dogs. This is extremely common. Fortunately, most of the lumps and bumps that pop up on dogs are benign, but there are the handful that are malignant. I learned, some of the little lessons you learn in life that you keep with you. One of the things I learned from one of my professors in vet school was that you can't make a microscopic diagnosis without a microscope. So you can look at lumps and bumps that look the same all day long, and it's going to be that one that you don't take a needle sample of and look at under the microscope that's cancer. So I always tell people, if they see a new lump pop up on their dog, it's always important to get it checked out to make sure it's not cancerous, because truly, like I said, we can look at them and feel them and say, it's probably this, it's probably that, but I'm not a human microscope as much as I would love to be. I actually still have to use a real microscope. And that's the best way to check out those lumps and bumps. But unfortunately, there's not a way to prevent them from happening. Some dogs are just prone to getting lumps and bumps. Some dogs will never get any. Some dogs may get one, but it is extremely common. And again, most of the time, it's not an issue.
That's great to know. I hate that it happens to them, but it's nice to know that we weren't alone in that journey, and that it's very
not at all. Not at all.
Fantastic. So going back to the nutrition for just a moment, I'm a firm believer in you get what you pay for, right? But dog food can get really expensive. I'm sure other pets' food can as well. What is your go-to either advice or brand of recommendation? Just in general, do you have a preference that you'd be, obviously we're not promoting it. This is not a paid.
Yeah. it depends on the situation. When I will say, kind of generally speaking, when my pet owners come in with new puppies or new kittens, depending on the breed, depending on the lifestyle of the owner and the animal, we'll talk through some different varieties. I'm, again, maybe a little different than a lot of vets in that I prefer some of the different diets that maybe not all vets recommend, but I like things like Holistic Select, Wellness, Origin, Nulo is a newer brand. And that's not to say that I don't still like some of the traditional brands like Purina, Hill Science Diet, Royal Canin. They make fabulous diets. And in fact, I carry diets from all of those companies on my shelves because I'm, a big believer that no one company does it right for every dog and every disease and every organ system. So it kind of, again, it just depends on what you like. But, all companies, Purina is a perfect example. Purina makes so many different diets. Probably their lower end brands are going to be like Beneful, but Beneful was a victim of great marketing. And so people think Beneful is healthy. It's actually not a very healthy dog food diet, but Purina is a great company. So even though they make Beneful, they also make these wonderful top of the line prescription diets, or even, their over the counter diets like Purina Pro Plan are good diets. So there's a wide variety. And again, the larger the company, the more broad variety they have from low end to high end diets. And it can be very, very confusing for sure. But there are a lot of good companies out there that make great over the counter diets. One of my things about diets when I evaluate diets is I really like to go with food companies that have veterinarians that work for them, because that tells me they're really doing their research and their science. And, like I said, these days, anybody can make a food and brand it and put it out there and call it great. But really the things that I carry on my shelves, I know they have veterinarians on staff. I know they do research on their foods appropriately, because for me, it has to be about the science and not just about the brand. Unfortunately, there's so many choices out there these days, but, and I honestly don't feed my dogs the same diet. I rotate their diet regularly, also to kind of help them from getting stuck in a rut where I can't feed them something different. Otherwise they get diarrhea. So sometimes rotating them, if you do it on a regular basis, prevents them from getting diarrhea if they eat something out of the ordinary too. So that's it in a nutshell. I don't know if that answered your question or not.
It did. No, that's fascinating. Once again, who would have thought that you need to think about whether or not these companies have, a legitimate veterinarian on staff? That's remarkable. So thank you for that little bit of advice.
Sure.
We are coming close to the end of this episode, sadly. I mean, we could talk to you for hours, I'm sure. One final question I'd like to get in that I think is really fascinating, and that's about CBD pet treats and supplements. Seem to be very popular right now. What's your take on these and advice?
Yeah, so CBD is one of these things that definitely shows a lot of promise in the veterinary world and probably the human world as well. The big thing with CBD, a lot of the studies on animals with CBD are extrapolated from human studies, and a lot of those studies are even extrapolated from human children, like anti-seizure effects and calming effects on children in CBD are extrapolated to dogs. And so we think that there will be a good place for CBD in the future, and that it probably will be a helpful supplement for our animals. The bad part about CBD is that it is not regulated right now. The FDA does not regulate it. It is surely a supplement. And so what that means is that the supplements you buy, it doesn't matter what they say on their label, it may not actually be accurate. So legally, these supplements are not supposed to have THC in them because, of course, that's a derivative of the marijuana plant. And so we don't want that out there with our dogs. There are some that may slip in. For the most part, that's not the issue. But the problem with the supplements not being regulated is that you could literally have the same brand of CBD, buy one bottle and it have a really high amount of CBD in it, buy the next bottle of the exact same brand and it have no CBD in it. So it's really hard to say what works and what doesn't because it's not regulated. So I tell people, the likelihood of causing any harm with CBD is very, very low. It's probably an extremely safe product, and I don't have a problem telling my clients to experiment with it. I just tell people,
buyer beware. You may get something and you think it works great and you got a good model, and you may get something and think it works terrible, and you may want to try a different brand because it may just be that brand didn't have enough CBD in it. So until it is more widely regulated, it's going to be really hard to use it effectively. But I don't think that it is a bad supplement. You just have to know that it may not be consistent from brand to brand and bottle to bottle.
Makes perfect sense. Perfect sense. Well, man, I don't want to keep you any longer. You've been so generous with your time.
Sure.
And Claudia, we're coming up here on the end. And
Yeah.
so I just want to say thank you once again. This has been so fascinating. And
My pleasure.
And we are so proud of you. Like, keep it up.
Yay, thank you.
Couldn't have done it without my North Texas years, for sure.
Yay.
Love to hear that. Oh my goodness. All right. Well, Dr. Tate, once again, thank you. And Claudia, I'm going to turn it back to you.
Yeah, let's say thank you to Dr. Tate. Raleigh says thank you. He's hopping around with joy. He loved this.